Welcome to the 15th lesson of the Positive Psychotherapy Introductory course, where we learn about the different fields and settings of application of PPT method from 70s till today. Positive psychotherapy was originally developed for mental health, psychosomatic medicine, prevention, and psychotherapy as a basic positive psychosomatic treatment, as used by several thousand medical doctors in Germany. It is applied in some hospitals, and in the state-licensed training program in psychodynamic therapy at the Wiesbaden Academy of Psychotherapy in Germany. Positive psychotherapy is applied for the treatment of substance use disorders, mood, affective disorders, neurotic, stress-related and somatoform disorders, behavioral syndromes related to physiological disorders and physical factors, personality and behavioral disorders, adverse living circumstances, and other mental health problems that do not meet the criteria for mental and behavioral disorders. Positive psychotherapy has been employed successfully side by side with classical individual therapy in the settings of couple, family, and group therapy. There is experience with the application of PPT to psychiatric disorders. Specifically, the use of stories and anecdotes has proven very effective in working with psychotic and post-psychotic patients and in group settings in psychiatric hospitals. The greater part of Nossrat Peseschkian's books is intended to be used by laypersons for self-help. Among those books are The Psychotherapy of Everyday Life, about dealing with misunderstandings, In Search of Meaning, about coping with life crises, and If You Want Something You Never Had, Then Do Something You Never Did, about interpersonal conflicts, as well as several books not yet translated from the German. Through courses for counselors, professionals can study and be certified to apply positive psychotherapy in conflict moderation and to stimulate self-help in conflict situations. The PPT method has also been applied in counseling in Germany since 1992. And in some countries such as Bulgaria in pedagogy as well since 1992, or in China since 2014 to train social workers about mental health disorders, how to cope with the families, and how to prevent burnout. It is an example of how to apply psychotherapeutic competences outside the classical psychotherapy and counseling fields. A specialized children and youth therapy training program, based on positive psychotherapy has been developed since 2006 in Bulgaria and later in Ukraine and Russia. Colleagues from Germany, Bulgaria, Cyprus, Turkey, Kosovo, China, Bolivia, and Ukraine are specializing in positive family therapy and counseling. The method became a bridge for sharing psychotherapeutic competences and experiences in other professional and cultural fields across different societies. Positive psychotherapy has been applied in numerous and varied situations, in education and schools, in management training, in coaching, in various counseling settings, in seminars for preparation for partnership or marriage, in recruiting, in trainings for teachers, officers, and politicians, in mediation for jurists and mediators, in intercultural trainings, in time management, in naturopathy and order therapy, also known as mind-body medicine, in stress management and coping, in burnout prevention, in the armed forces and society, in the psychology of religion, and in supervision. Other areas include coaching, family counseling, and general counseling. This was the 15th lesson about application of positive psychotherapy. Like this video and subscribe to our channel. See you in the next videos.